Hello everyone, my name is Fidelis Tenen. So I'll be talking on patient profile, and the patient is having iron deficiency anemia and hypertension. So the patient is Arthur John, who is 69 years old, was born in 1955. He's a male patient. He has the primary diagnosis of low hematocrit, microcytic red blood cells, and high blood pressure. And his secondary diagnosis is gastrointestinal bleeding, iron malabsorption, and anemia. John is allergic to ibuprofen, and currently John is on 3 medications: dithiazem, ferrous sulfate, and lisinopril. John is a full code and is covered by Medicaid. For John's chief concerns, John has been complaining of chest pain radiating to the neck or to the arm, and the pain level is 7 on a scale of 0 to 10. John is having difficulty breathing, and John's blood pressure is 156/96, which is high. His heart rate is 120, which is also high, and his respiratory rate is 28 beats per minute, which is high too. And John has been complaining of feeling tired and weak all the time. So as I earlier said, John is on 3 medications: ferrous sulfate to prevent iron deficiency or to do with the iron deficiency. Then he's equally on lisinopril and dithiazem, which are hypertensive medications to bring down the hypertension. So for John, a mini nutritional survey was carried out, and the sheet is attached to this presentation. For history of present illness, Mr. John complained of fatigue, lightheadedness, and he also said his heart is pounding, and he is having low appetite, or he has had loss of appetite for the past 2 weeks, and he has been experiencing high blood pressure for the past 3 years. For past medical history, Mr. John had an accident 10 years ago which led to brain surgery. As a kid, he was malnourished. He has been smoking for 25 years and successfully ceased smoking last year. John used to drink a lot of alcohol, but his alcohol intake has drastically reduced because of his health. And when John was growing up, he was very busy and complained that he could not exercise because of his tight schedule. John is allergic to ibuprofen, and John used to drink a lot of coffee to keep awake during work hours in the 90s and early 2000s when he was in active service. For family history, John's father was obese and hypertensive. His mother was hypertensive too. His twin brother, who is still living, is obese. And actually, John's father died of hypertension a few years ago. So for the psychosocial aspect, John complains of feeling depressed because of his health concerns. He also complains of having suicidal thoughts. Yeah, he's feeling lonely because of the loss of his wife 3 months ago. He just retired. He's not working, so his income is down. So financially, he's not very strong, which is also contributing to his depression. For health promotion, Because he's stressed, he doesn't get enough sleep. He complains of not drinking water. He doesn't like to drink water, but would prefer to drink something like soda or any other sweet drink, which are not very good for him because they can increase his blood sugar level, which is not very good for a hypertensive patient. He has not been eating well. Yeah, he has loss of appetite. And because of loss of appetite, he may not be absorbing much iron, and that can further lead to the complications of iron deficiency. John says he tried exercising 2 times weekly but had to stop because he was feeling dizzy. For an overview of John's systems, his muscles are weak, he has pale skin, he's been complaining of pain in the chest radiating to the neck and arm, and he has difficulty breathing. From the information gathered from his nutritional concerns and mini nutritional assessment, John has loss of appetite, which can lead to low intake of iron. And John has been taking iron supplements, but his iron level is still low because of intestinal bleeding, so he has been losing much blood. So for his nutritional needs, John should take a healthy diet rich in iron. John should limit sugar intake, limit saturated fat, drink at least 2 liters of water in a day, should take less of alcohol, if possible cease from taking alcohol, take a diet that is low in sodium, and eat protein-rich foods, and special emphasis on foods that are rich in vitamins too, like vegetables and fruits, and even whole grains will be very healthy for John. So for short-term and long-term goals, the short-term goals that I have for Mr. John is for John to maintain a stable hematocrit and hemoglobin within safe levels over the next 48 to 72 hours. That's a short-term goal. Another short-term goal is for the patient's blood pressure to remain below 140/90 millimeters of mercury within the next 24 to 48 hours. So the interventions that I have for these short-term goals, the first intervention is to monitor his hemoglobin and hematocrit levels regularly, and to administer ferrous sulfate as prescribed by the provider, and also ensure that the supplement that is taken is absorbed. How to encourage rich iron foods such as beans, meat, spinach, and even fortified cereals. Another intervention is to assess for signs of fatigue, dizziness, and pallor, which may indicate worsening anemia. I will also monitor blood pressure frequently and assess for signs of hypertension. I will educate the patient on low sodium intake and other healthy diets or heart-healthy diet choices. And lastly, the last intervention I will have for the short-term goals is to administer antihypertensive medications like lisinopril and diltiazem as prescribed by the provider. Then the long-term goal I'm going to set for John will be for John to demonstrate a gradual increase in hematocrit and hemoglobin levels over the next 4 to 6 weeks, and for John to prevent further iron deficiency by maintaining proper dietary intake and adherence to supplementation for 3 to 6 months. And to achieve this, I'll constantly monitor for iron absorption issues. or malabsorption issues that may require alternative supplementation strategies. And lastly, I will assess for signs of fatigue, dizziness, and pallor, which may indicate worsening anemia. To evaluate this patient for the evaluation of this whole situation, I will monitor the complete blood count results within 48 to 72 hours to assess for improvement. I will assess for symptom relief after several days of treatment. I will evaluate patient's adherence to iron therapy by asking about medication schedule, side effects, and dietary intake. I will assess for any signs of iron and adjust interventions accordingly. And lastly, if the hematocrit and hemoglobin levels stabilize or increase within a few weeks, then the interventions were successful. I think as a nursing student to be coming up with this presentation was very challenging, considering the fact that this is my first presentation of this kind. But however, I did my best to make sure that I come up with something that can help my patient, Mr. John, who is 69 years old, and I hope that with subsequent presentations of this nature, I'm going to improve, I'm going to do something better. And I equally think by the end of this program, after doing many of such presentations, I am going to improve and be a good nurse. Thank you so much.